Good afternoon, everyone. I'm Anthony Morales. Today I'm going to give a little information on a subject that's pretty dear to me. Alright, so could anyone guess what's the leading, on the rise as of 2016, what's the leading disorder that's going on? Autism. Yes. So I'm going to take a quick second, take one, pass around, so everybody gets one. So as you're passing that around, I just want you to pay attention. This comes from a childhood favorite for everybody. Quick quote. It says, "Why fit in? We're born to stand out." By Dr. Seuss. Dr. Seuss is a real big advocate of autism, and I chose that quote because he's a big advocate for autism. So if you can go around, I don't have it on my actual pass handout, but anyone know the symbol for autism? The puzzle piece. The puzzle piece symbolizing pretty much because scientists and medical professionals don't know what are the main causes of autism. Autism is a puzzling disorder, if you will, which is why it's the symptom or the sign for it. So the puzzle piece is so effective because it tells something about autism. Our children are handicapped by a puzzling condition. This isolates them from normal human contact, and before they don't fit in, which I really don't agree with. So again, we're going to talk about autism. According to CTC in 2016, the United States estimated that 1 in 68 children are born with autism. And more than 3.5 million Americans live with autism spectrum disorder. So pay attention when I say spectrum disorder. Look down at your handout, I have a little spectrum right there. Autism isn't just based off, just simply autism. There's many forms of it. So before we get into that, let's talk about what is autism. Someone read me that little paragraph.
Autism spectrum disorder and autism are both general terms for a group of complex disorders of brain development. These disorders are characterized in varying degrees by difficulties in social interaction, verbal and nonverbal communication, and repetitive behavior.
Exactly. So the earliest signs of autism, the earliest signs manifest before you're 3 years old. Things that include that they have problems with is trouble interacting with others or playing with other children, little or brief eye contact, not pointing at objects, calling for attention, unusual repetitive movements such as flapping, slapping of the hands, tapping, spinning, things of that sort. They're characterized by 3 subgroups. Social communication they have issues with. They have trouble like normal, like us who don't have autism. They can't understand a pitch and tone of voice, meaning if they're getting disciplined by just raising their voice or not, like parents raising their voice, they don't know the difference between raising their voice. Facial expressions, you can pick up gestures off body language and things pretty easy. They fail to do so. And common jokes and phrases, they can't pick it up. Social interaction. Most autistic people see the world in huge mass of people. It's been studied that autism is pretty much like a giant anxiety attack to them. That's why they need cope. They start tapping and things like that to help cope with their anxiety. The third subgroup of it is social imagization. The distortion of sensory perception have been linked to certain brain abnormalities discovered in the brain, autopsies and MRI images of different people with autism. If you look down at the autism spectrum, there's not just certain types of autism. I know y'all know a little bit about autism. You might hear severe autism, mild autism, high functioning autism. Those aren't really true diagnoses at all. That's just like a brief way to kind of explain the severity of autism that a child might have, to kind of help parents understand their child. Example of high functioning autism is if you look at that picture of that woman right there, it's Dr. Temple Grandin. There's actually a movie based upon her, and she helped shed light to the medical profession because she's a high-functioning autistic individual. She has a doctor's degree. She's helped out with cattle and agriculture, things like that. She's able to talk. If I encourage you to watch the movie to kind of get bases off. autism. I have a 5-year-old nephew who's autistic, and it was kind of hard for me to understand how to deal with him, things like that, because it was so brand new to me. But after watching this movie, it helped me pick up a lot of signs and mannerisms, kind of help teach me as well as my family how to help him out. That's what I'm trying to, I guess, figure out on my own. How can we help ease their mind and help out with their day-to-day issues. So in conclusion, we went over autism, a couple signs of autism, when they manifest, which is around 3 years old. Give you the individual, Dr. Temple Grandin, that you could look up for references if you ever want to kind of get inside the brain of an autistic individual. And in my opinion, autism isn't really a disorder, it's just a different way of seeing the world. Again, hope that you kind of understand the keys of it and understand that if we could help them, if we could learn how they think, that we could help them and make them understand our world a little better too. So that concludes my informational speech. Appreciate y'all being here.
Well,